Yeah, some questions for the audience. If there are questions from the audience, please line up at the mics. This will be Mike on my left and Mike on my right. While we're doing that, let me ask Ms. Linscott if you could maybe comment. One of the policies that is beginning to be considered around the nation is raising the age for tobacco to the age of 21. Do you have any perspectives on that?
I think unsurprisingly, my perspective would be like, yes, that sounds like a good policy. No, I think, there's been multiple states that are considering it, have considered it, passed that. And I think it's a very, very good first step into really protecting the health of youth. The problem, however, is that, the age right now is 18 for most states, and youth are still getting access to these products. And so this, obviously is a big issue. And I think at least one of the answers, I can't say I know all the answers to it, but I think at least one of the answers is really cultivating the power of the youth voice. So we talked a little bit about partnerships in trying to make 2030 America, have America be the healthiest nation. And I think one way to really do that is to realize that youth have every bit a place at the table as adults do in assessing the health of the nation and trying to promote the health of the nation as well. For, a lot of youth, it's kind of, I don't know, it's a different world than the world of my parents and my grandparents, and it can be a scarier world. And I think it's important that youth recognize that they have power to really promote healthy communities. And so, you talked about a specific example, and even on a small scale, I will say this. I've been to several different conferences, and I've spoken to a lot of really passionate youth advocates, not just about tobacco control, but just about making a difference and trying to change the world in whatever way they can. And I think there's a lot of untapped potential there. There's a lot of people who say that millennials are, what's that word, like lazy, entitled, narcissists, that sort of thing. And I think, it might be true on one level, but I think the youth of this nation really do deserve a chance at trying to prove and trying to really help empower others. So that's my piece.
Thank you. Let me, if there's some questions from the audience or questions from Twitter.
I'm following questions from Twitter, so there's been a number of them.
Is it on, the mic?
Is it on?
Yeah, it's on. Yeah.
So let me start with, I'm building on that conversation we were just having. I'll start with the conversation we were just having.
It's not on?
I will start with the conversation we were just having. From 100 Million Healthier Lives, we believe we need unprecedented partnership across sectors. What are some unique partnerships we can make?
The most important partnerships, I think, are going to be between communities that are affected by all of these things we're trying to solve and the people who are trying to solve the problems. So the most important partnerships are whenever we're at a problem-solving table to look around and say, who is not at this table, who has an interest in this proceeding? And then not to just try to represent their interests, but to bring them to the table.
Yeah, the one thing I was going to start off by saying exactly what Camara said, which is making sure that we include the people that are affected. One of the things I have seen sometimes in a lot of local governments is partnerships between folks who disagree. Sometimes it's easier to disagree when you're in smaller communities because there is less visibility. But sometimes when people have different views and they end up clashing and then coming together with a solution, I've found presents for unique and interesting insight from both ends. So I would add on to what Camara said, that the idea of including the people that are affected would be particularly important, but also making sure that you bridge the lines of understanding between red or blue, green or yellow, black or white, or whatever divisive line one might think of.
Go ahead. No, go ahead.
No, so I've been scribbling
Go ahead. School.
frantically. Because I wanted to also build on what you said about involving youth. So I'm going to jump out there and say that most of us are not doing succession planning at work or anywhere, right? And involving youth is how that's succession planning, to bring people up behind you and train them and the like. And so I need to really applaud our association, the APHA, because even articulating a goal that is a generational goal is something that we don't do in the United States typically, because we aren't really thinking about even our children's health typically. And many American Indian nations think about 7 generations hence. That's succession planning. When you think about the environment, 7 generations hence. When you think about, you know, educational opportunities or whatever. So thank you for lifting up the importance of involving youth. We should all take that to heart and think in our own lives, in our churches or wherever we are, in our communities, we need to start involving youth, because that is how you touch the next generation. We're so selfish that we just think, okay, well, when I'm dead, that's gone, the story's over. And if we start having a kind of generational, healthiest nation in 1 generation, 7 generations hence, we will protect this world and our society and our people much better.
And just to add on to that, I think it was so easy for this week's theme for, you know, the APHA to kind of have a theme of just celebrating previous successes, because there have been so many in recent years. But I really want to applaud this organization for recognizing that we're kind of looking ahead to the future and looking ahead at 2030 and being, how can we really make the U.S. the healthiest nation? And I think that is a wonderful theme, and I think that youth definitely have a place at the table for that theme as well.
Thank you. You know, I wanted to have one of our critical partners speak. So Lee Fisher, from CEO from Cities.
My question has been touched on, but I'll just offer a different perspective, and that is, when you bring a cross-sector team together to advance the health of a city or a county or a tribal nation or the nation itself, very often public policy makers react more positively when you see it through an economic lens. So my question is, have you given any thought, or do you know of any strategies or approaches that have worked so that public policy makers can understand why having a healthier nation makes us a more economically prosperous nation?
So I have to admit that I do not like to go there. I do not like to quantify people's lives or people's value on that, but I recognize that that is a strategy that has worked in this society.
Well, I can give one example. So, some of you may know, and I've used this example a lot, and so I apologize to my good friends and colleagues in New York City for this concept that they've really embellished and really made popular. But they've got something called the green card experiment in New York City. And of course, everyone who's been in New York is very familiar with the little food vendors on the corner. And we won't have the discussion today about whether or not what they sell is healthy food or not, but I can tell you it's good.
Right, that's exactly right.
Very, very good.
That's right.
But they had a big debate about food deserts in the city. And they were looking for meaningful solutions to food deserts. And so they decided to expand, I think, about 1,000 licenses for new food vendors. But they could only sell healthy fruits and vegetables in communities that were underserved with fresh fruits and vegetables. So they created a new business model and provided a public service. And they got rid of a couple myths. I saw the evaluation of the project, and a couple of the myths. Myth number one was that underserved populations and low-income people would not buy fresh fruits and vegetables. All right? Turns out that folks in underserved communities like their vegetables fresh and their vegetables frame and their vegetables tasty, like everyone else. And of course, they will buy fresh fruits and vegetables if you offer fresh fruits and vegetables. Of course, the other thing is they have to be affordable. And so affordable fresh fruits and vegetables through this project makes a lot of sense. Now, it's a great model, and my understanding it's been very successful. But it's not, applicable to every community. But, for communities that that can't do the carts, folks have bought refrigerated trucks and vans to take it to other communities. So I know there are other communities in the Midwest that have looked at this model and thought about trying to do it. The point is that it creates jobs for folks, and it creates access to foods and fresh fruits and vegetables, and begins to change the model of food deserts in communities. Saw another one when I was in New Jersey, and went into one of the community bodegas, a little small community store, and the question was, can you sell, and from a business perspective, salads and fruit cups? And it turns out, yes, you can. What they needed was someone to help them buy basically a chiller, refrigerator, in this small store, and the salads and vegetable cups are flying off the shelf. I think they're $1 or $2. They're flying off the shelf. Now, we have to get that particular store to stop selling tobacco. They're still selling tobacco. But here's a place where there is an economic model to try to build them a revenue stream on something other than, high caloric, high fat, low nutritious foods. And hopefully at some point that, they'll be able to see the economic tipping point where one can then go in and have a reasonable discussion with them about not selling tobacco. So those are a couple models, Lee. Please, Chair, but you need to go to the mic. Or yeah, she's got a mic for you.
The green carts in New York, one of the key things about it also was that if you got that license, you had to accept food SNAP. You had to accept the SNAP benefits, A, and B, locate in strategic places, including outside of Head Start programs in the evenings when people would be picking up their children. So you truly are creating accessibility financially and in terms of geographic access, just to elaborate on it. Because when I was at the Kellogg Foundation, we put money into that program that you're talking about, the green cards. And so it was really a viable way to do exactly, and encourage farmers to bring their foods into the cities, into the Bronx, and into Queens, and into those communities that had the food deserts. Yeah. So it was a phenomenal model. And then another model I wanted to share was in the New York Times a few months ago, where they showcased a superintendent in Jennings, Missouri, which is a community right next to Ferguson. And she was a superintendent of schools, and she single-handedly partnerships brought a shelter, because she was having a lot of kids that were missing school, right? We talk about education being a significant strategy. And so she went about the business of removing those barriers that kept kids from not excelling in school and not being present to be able to excel in school. And homelessness was an issue. Access to food was an issue. She had a shelter located very near, it was in the New York Times, a shelter located very near the school so that the kids that from her school would get preference of being housed at that shelter. Food was an issue as well. Access to the uniforms, it was a uniformed school district, et cetera, et cetera. She removed single-handedly, with partnerships, but it was her vision that said, I want kids to be able to complete school, and I'm going to remove those barriers. So there's an example, because it required housing. It required, a number of the local industries in that community to come together to remove those barriers. So we have some pearls out there.
Thank you. Microphone on my left.
Hi, my name's Julie. I'm a current NPH student at GW. I was really struck by what you were talking about with, some schools they offer yoga and these healthy options and some schools don't. And I think that's interesting because I think then at a young age you're telling children who are at these schools with healthy options, you deserve it. You have a right to prioritize your health and you have a right to prioritize preventive health. So I was wondering if as you're looking into these healthy, planning programs for communities in the future, it's one thing to say, welcome to the table, here's food on it, you're part of the conversation, sit down and eat. But do you see any pushback from community members once the access is there, with them thinking that they deserve it, or without them realizing that it's for them and that they can use it?
Yeah. So if I'm understanding your question correctly, it is if when you create the actual access point, will people actually take advantage of it? And it reminds me of this experience I had when I was in the federal government. This was particularly around Medicare Part D. And many times when people would open up these very fancy things to try and recruit people and get them to sign up for these things, and people wouldn't show up because they had never had any experience with a particular institution. In fact, in some of our finest branded huge hospitals that have all kinds of national rankings, many people from those low-income communities will drive past that shiny hospital to go to the hospital that has a history of accepting them in the past. And I've been in many of those institutions and seen people do that. And so what you learn from that is communities have a memory, and they have a track record of experience, and they remember the kinds of people who are there for them through tumultuous times, and it might be 50 years ago, it might be 70 years ago, and kind of understanding that history. So I think part of what the solution is understanding the history of each location, understanding the dynamics of the community, and understanding where people feel comfortable to be able to either access a service, whether it be a service around a government program or even a service around their own health. And sometimes it's not just about building the shiniest building or putting on the shiniest badge, but being able to have people understand that that place is actually for them and that they feel comfortable there.
Dr. Jones, before you say it, let me just say one thing about kids. I've got 2 grandkids, and I got to tell you, it's wonderful watching grandkids, because you, as a parent, you watch grandkids differently than you watch your kids for different things. And I got to tell you, one of the things that I've certainly have observed is they don't miss much. And the assumption that they don't know in an environment in which there's 24 hours a day, 7-day-a-week news cycle, TV, radio, access to communication, and they're talking to their friends about stuff. And my grandson came home talking about a cartoon character, excited about this cartoon character that he had never seen. And then when he saw it, he was really excited, but he had never seen it. And so the idea that because someone goes to a school that doesn't have the same services or food choices or other choices as someone else, that they don't know the difference, is a fallacy. They absolutely know the difference. Because we're clearly in a globalized world now, in globalized communities. And so they know. And it has to do a lot to their belief of self and self-esteem, et cetera. And so again, it's part of this, the idea of valuing everyone. We need to sometimes step back and think about things through their lenses. Thank you for that question.
Sorry, just to jump off a point that was said earlier about understanding the cultural histories of communities in which we serve, I think that brings up a really good point about recognizing the value of cultural competency. So often we like to think of the communities that we live in, or even the nation as a whole, as this giant melting pot. I've heard that analogy a lot, and I think that might be the wrong analogy to use, because that means that everyone's cultures just kind of assimilates into this big blob, and it's just kind of gray. I think a more appropriate analogy would be to recognize that the rich cultural diversity that's found in our communities and in our nation is more like a tapestry in which it's we recognize the differences and we celebrate those differences. And so I think it's important when we serve in communities or we're trying to pass policies to recognize the cultural diversity and practice cultural competency as well.
And I wanted to pick up on this very rich conversation by first offering my definition of health equity, because it talks about partnership, it talks about all of these things, and then talking very briefly about societal barriers here in the United States to achieving health equity and like what we need to do. So when I talk about when I define health equity, I ask, what is it? How can we get there? And how is it related to health disparities? And I define health equity as assurance of the conditions for optimal health for all people. And this is actually slightly different from the Healthy People 2020 definition, which is assessment of the, no, they say health equity is attainment of the highest level of health for all people. And I agree that's our goal, but what bothers me about that is what if we hit it last Sunday, are we done? And I'm quite clear that health equity has to be a process, it's not an outcome. And which process? The process is assurance, which is actually one of the 3 core functions of public health identified by the Institute of Medicine, along with assessment and policy development. And assurance of what? Of the conditions for optimal health. So that's when you get all of the partnerships in. That's where you get the housing and education and transportation and immigration and justice and all there. Assurance of the conditions for optimal health for whom? For all people. How do we get there? Achieving health equity requires at least these 3 things. The first is valuing all individuals and populations equally. We keep coming back to this notion of societal valuation, but that is key. The second is recognizing and rectifying historical injustices. So I was so happy, Dr. Graham, you talked about history and the role of history, so we'll come back to that. The third is providing resources according to need, not equally, but according to need. Because actually the difference between equality and equity is that equity recognizes history, historical injustices, and it recognizes real differences in need. How is health equity related to health disparities? Health disparities will be eliminated when health equity is achieved. Health disparities is about the outcomes. Health equity is all that came before. Now, the societal barriers that we have to achieving health equity, like, you know, there are a lot of smart people in this room who are talking all this talk and trying to do this work. We have 3 huge things that we have to tackle. The first is that we are ahistorical as a society. We act as if the current distribution of resources and risk is just happenstance, right? And that things have always been the way they are, and that structures and systems are not modifiable. They're immutable. The second is that we have a very narrow focus on the individual. So we don't have this sense of we're all in this together or any of that. We don't have a sense of collective efficacy or interdependence. And when you are so focused on the individual, then systems and structures become invisible or irrelevant. You would rather spend money trying to change the genome than change the huge structures and societal barriers and facilitators that are in our society. The third huge thing is that, and some people might be surprised when I say this, but what I describe as the myth of meritocracy. Our American story goes something like this. If you work hard, you will make it. Now, clearly, most people who have made it have worked hard. Not everybody who's made it has worked hard, but most people who have made it have worked hard. But there are many, many other people who are working just as hard or harder who will never make it because of an uneven playing field. And all of these systems of structural inequity, especially racism, are key in creating and maintaining that uneven playing field. So when we think about one generation, when we think about the babies that are born, do we really think that 2 babies are born with equal potential, or do we think they're born with equal opportunity? If you think that 2 babies are born with equal potential and then they grow up with uneven outcomes, you have to look at systems and structures to figure out what's going on and how you're going to improve things. But if you think that people are born with equal opportunity, and you see uneven outcomes, then this one is either inherently inferior or lazy or stupid. So one of the things, I keep going back because it's such a brilliant vision of like your life and going around to states. What you did, you had the opportunity to burst through bubbles. Because your family kept putting you in one bubble and another, you had the opportunity. All of us are traveling around in our work and school and community and our kids' school and all whatever bubbles. Some of the bubbles are thick plexiglass and some of them are thinner. But what you had the opportunity to do by seeing different schools is to understand your common humanity and other people's common humanity in different circumstances. And what I think that public health needs to do, and all of us need to do, is create opportunities for us to all burst through our bubbles and experience our common humanity, to understand that there's somebody just across town who's just as funny, kind, smart, hardworking, generous as we are, who lives in very different circumstances. When we start doing that, we will start asking the why questions, and we will all be urgently engaged in trying to achieve health equity.
There are several questions from Twitter recognizing that this is a political year and a presidential campaign year. And the questions are completely nonpartisan, but it really is, what should the conversation be at that level? What policies would we like to see leaders talking about to address the issues of equity and disparity and social justice and social determinants?
You know, certainly, I think speaking for APHA, I can tell you for sure we would love to see Congress investing more in broader efforts around the social determinants of health. That means continuing to support the Public Health Prevention Fund and the community-based interventions that they have been supporting, fully investing in the community task force, preventive health task force, the clinical preventive health task force, addressing climate change as a threat to human health, doing some very aggressive things around tobacco. I would love to see the age 21 nationwide. I would love to see the Congress ratify the Framework Convention on Tobacco. I would love to see tobacco removed from the TPP agreement, as we've all advocated for, at least the public health community. I think the challenges we have, of course, are that all politics at the end of the day is local, and getting to the point where policymakers are thinking broadly about things upstream and maintaining some sustainability around public health. So I just was at the Center for Disease Control and Prevention on Friday at the Zika Summit. You know, so it's our newest emerging infectious disease. And it was very clear in talking with policymakers that were there, health officers that were there, people that run mosquito programs, the fact that we've had, and that we've just totally destroyed our environmental health programs in the country. The funding cuts have just pulled the rug from under the programs, so that, you know, we don't have great environmental programs. We see this in Flint, and that's the tip of the iceberg. I mean, all of our cities are getting older, and we have all the political issues there aside, the decaying infrastructure in our nation. It's our water systems, it's our approach to clean air, it's our bridges and infrastructure. I saw an article the other day that one of my staff, I think Dr. Wright, sent to me, where the current Secretary of Transportation was talking about the need to begin using more dollars in building infrastructure. And this also goes back to your question, Lee, about jobs and economic development. So as our nation begins to embark on a revitalization of our infrastructure, which we're going to have to do, because otherwise things are going to just start falling apart from under us. We got to think a lot about how we build roads and how we build expressways, how we rebuild them. We have to think about, why is it that people talk about those people on the other side of the tracks? Well, they're not on the other side of the tracks by accident. Those roads were built very strategically to divide communities. Some of it was because that's where the cheap land was. Some of that was because of the engineering and topography, for sure. But as we rebuild communities, we've got to begin thinking about how we build those communities in such a way so that our kids can see the school and also get to the school, but don't have to get on a bus to drive to the school because of the way we've designed the transportation community and the roads for the convenience of the cars and not for the convenience of people, as an example. And by the way, when we do that and putting people back to work, you know, there's an enormous, and we're going to spend the money anyway, So let's do it in a way that improves our health and gets us from point A to point B.
Well, so I have, yes, pay a living wage. Living wage. I sort of divided into breaking down barriers to opportunity and building bridges to opportunity. So the breaking down barriers to opportunity, so let's abandon this ill-conceived war on drugs that is disproportionately incarcerating so many black and brown men in our prison system. Let's, in terms of bridges to opportunity, strong early childhood education, strong social security around families, even, you know, building the infrastructure, jobs programs like back, you know, after the first big crash, you know, let's have a works program that can employ people. And then even on the health side, there's an old model called community-oriented primary care, which was where a health center took responsibility for the health and well-being of a geographically defined community, so that they weren't just trying to take excellent care of the people who made their way to the door, but they were also trying to address unmet and even unrecognized need in partnership with community leaders. And it involved not just, well, a big part of it was the hiring, training, and deployment of community health workers, which is a jobs program. But it's not just to do patient navigation, but to identify community risk and assets and do community education, all of that. What if we took that as a model that would represent the marriage between public health and medicine? So lots of ideas.
You know, my answer is probably way too personal, but I had a kid not too long ago, actually two, in rapid succession, which has been painful. And my view of what's needed for these 3 and 1 year old little bundles of joy that keep us up at night is what's changed my view of kind of politics and politicians and the future. And a lot of it has to do with when I look at my sons and I see that I want for them the best in the world and all the kinds of opportunities that anybody else could have. I then get saddened by people who feel the same way but are not economically advantaged to be able to achieve and give their kids the same thing, because we're going to give our kids everything we can, and I know most parents would. And so when I sit back and I think of kind of the politics and the dynamics and the kind of where we are as a country where we need to be, I think I would change the discussion to say to each candidate, each campaign, you know, what would you do to give everyone in this country the best opportunity they could have to live the longest that they could be and be the most successful they can be, and not think of any other strategy other than that, because I think that's what we all want for ourselves now, and we all want for our kids in the future.
Thank you. I'm going to take one more question from Twitter, and then I've got a lightning round of kind of closing questions from each of our individual panelists. Dr. Poland.
The question from Twitter was, what role will technology play in all of these issues as we're moving forward?
Let me put you.
Yeah. So, you know, our foundation, actually, really, it's Elise who's sitting here in front of us and all her brain power, and I was taking all the credit for it, has really been dedicated to this issue of how can we use technology to serve underserved communities. So we're trying to fund projects that have little to do with technology at being advanced for just generic advancement, but how do you apply it to poor and underserved communities? And one of the things I've learned from this process is that we have a distinct emphasis in how we deploy technology towards a worried well right now, which means that I look at my wife. My wife is not just a picture of beauty, but of great health. And she has the thing around her wrist, she has the thing around her neck, she has the thing, and when she walks into her house, thing goes off, and she's the person who needs it the least. But those are the people that currently I think our technology, and it's very effective for her, but our technological developments are directed and applied towards that population. And so we want to see it directed to those who need it the most. And we do see where something as generic as connectivity through social media can cause a wave of change, sometimes good, sometimes challenging. But we do see sometimes even in organizational structure within a lot of poor and underserved communities where people come together through social media and the kinds of tools that those things can afford. So we're not there as a country yet, but I think we can achieve amazing things if we started to slide the deployment of the kinds of technology that empower people towards those who need it the most.
Ms. Linscott, why don't you, I know you've done social media, why don't you talk to us a little bit about that?
Sure, yeah. So I think, technology can be an incredibly powerful tool, particularly that of social media. We all like to think that social media is an entirely new concept and it's never been heard of before, at least, it just sprung up in the last 20 years, when in fact it might just be a remediation of prior existing media. But I think with social media, it's very important to recognize that you can reach a large number of people relatively easily. So with the Not a Replacement campaign, what we did is we had youth take selfie statements and they uploaded it to social media. And so that did one of two things. It allowed the youth to be engaged in an advocacy effort, and it also allowed their friends and their followers and their the likes to their pages, all of those people, all of those individuals and their groups got to see that message. So I think when we're talking about technology, the idea of using it as a platform for education and using it as a platform for engagement, particularly that of the youth, can be very important, because with that Not a Replacement campaign, over the course of the first year it was out, we had nearly 5,000 youth in Florida do it. And then in Kick Butt's Day, for that second year, we had even more youth take part in that initiative. And so I think the power of social media and harnessing that can be very, very, very helpful when thinking about educating the population.
Thank you. Let me do maybe a little lightning round here. If I could maybe just ask Dr. Jones, if you would talk a bit about, kind of as your closing statement about getting our affiliates. We have affiliates in every state in the nation, the District of Columbia and Puerto Rico. If you could talk about engaging them in the work of public health that we're doing, and how they might get involved in some of the work of the association, including this kind of Healthy Cities activity.
Well, that wasn't what I wanted to end with. So I can do both? I'll answer the question and then I'll pivot, okay? Well, I think first of all, I have traveled to just 3 of the affiliates so far of my 18, because most of the meetings that I go to, the public health meetings, they will be next week and the week after.
But they're all listening.
I know, I mean, there's like, and then in September and October. But what I'm struck by is that the members of the affiliates are very engaged in not only the work of public health, but kind of the state level legislative efforts of public health. And I think that that's just where we need to have more liaison and partnership, if I will. And I think that the American Public Health Association does a great job with affiliate affairs in supporting the affiliates and connecting the affiliates. One of the challenges as I'm going around, because as I said, I've announced this national campaign against racism, one of the things that I'm letting people be aware of is that there actually is an international anti-racism treaty. You talked about the Tobacco Convention. There is something called the International Convention on the Elimination of All Forms of Racial Discrimination, which was adopted by the UN General Assembly way back in 1965. ICERD, I-C-E-R-D, if you want to tweet that or Google it later and get there. And so, I'll ask the people sitting here, how many of you think the U.S. signed this International Convention on the Elimination of All Forms of Racial Discrimination? Like most people think no, but we did. We signed it in 1966. But the key there is you can sign a treaty, but if the Senate doesn't ratify it, then it doesn't. So how many of you think that the Senate ratified this treaty? They did. The U.S. Senate ratified the treaty 28 years later, so in 1994, which means that today, we as a nation have international treaty obligations to do right under this treaty, which includes our State Department writes periodic reports to a UN committee. The committee gets all the gets that report plus as many other shadow reports as people want to send in. So APHA could send in a shadow report. Any of our state affiliates, any organization could send in a parallel report. At the last consideration of our report in 2013, the committee had the U.S. 69-page official report and 82 parallel reports. They considered all of that, and they sent back to us in September of 2014 their 14-page concluding observations, which goes something like this. Dear United States, thank you for your report. We remain concerned about racial segregation, disproportionate incarceration, the achievement gap in education, differential access to health care, disproportionate incarceration, on and on and on and on. And they also, and so they not only remain concerned about, they make recommendations on each of these topics, and they also recommended for the first time that the U.S. establish a national action plan to combat structural racial discrimination. So not only is APHA interested in a national campaign against racism, but the U.S. has been instructed that we need a national action plan to combat racial discrimination. They also say, dear United States, you need to let your people know about the existence of this treaty. So every time I have an audience, I do my part, which is what I wanted to close with. But when you talk about the affiliates, honestly, it's a 14-page concluding observation document, and I actually recommend that all of our state affiliates and all of our partners across the land get that 14-page document, look at it, because there's at least 1 or 2 paragraphs that can be a basis for community mobilization and action, whatever area, whether you're in housing or transportation, wherever you are, where criminal justice system, there is something that speaks to you that we have international treaty obligations to address.
Ms. Linscott, closing comment?
Just closing comments. It's an honor to be here again. Preparing to study for that test, thinking about that. But I would just like to close with, I think, and I said this earlier, I think the power of the youth voice is so important, and fostering that youth and adult relationship and partnering with them in communities for community projects of all scopes and sizes, I think is quite important. We had a Kick Butts Day event around last week, and for those of you who don't know, Kick Butts Day is a national day of youth activism in which youth advocates across the nation advocate for tobacco-free policies. And this year's Kick Butts Day was a huge success. We had events not only around the U.S., but in Canada and around the world. And I think fostering that passion for healthy behaviors is so important as we work ahead to meeting our goal in 2030.
Thank you. Dr. Graham.
I kind of alluded to this before. I'm around kids a lot these days, little kids. And their excitement is so infectious, and it makes me get passionate about things that we need to be doing and things that we should be doing to create a better future. As we start kind of National Public Health Week and we start talking about this challenge that we're kicking off and all these different things, there are things that other foundations are doing some amazing things on the culture of health with Robert Wood Johnson and all these great things that Kellogg is doing addressing racism and all of these things that are occurring across our country. Let's get excited about this and start promoting and getting other people infectiously excited about getting this. Let's tweet it. I don't know what these young kids do nowadays. That's whatever these kids guys do. Let's Twitter it. I heard you say pound as opposed to hashtag, and somebody told me that's a sign of age. He said pound instead of hashtag. He said pound it. But let's do all the kinds of things that we need to do, even if just for today, to be genuinely excited about how we can make a change. Because I think that if we aren't excited, if we aren't the group that's driving this excitement, if we aren't the group that is going to, tweet something to oblivion or whatever we got to do around challenging racism, around challenging inequities, around moving forward, even just for one day, I would like us to just be excited about the kinds of things we do. If not for this day, let's do it commit to doing this for the rest of National Public Health Week. If not, let's make this National Public Health Year. But more importantly, if there's anything I want us to try and do is to be able to take all the energies that we're hearing, all the passion, all the wisdom, especially from Camara and others, and generate some real excitement around how we can address the social determinants of health.
Well, thank you. Let me also just close, talk a little bit about some of the other things that are going to happen this week. This actually, for those of you who are in the Washington, D.C. area, I think there's from 5 to 7 at APHA headquarters at 800 I Street. There's a happy a healthy happy hour. Healthy happy hour. That's today from 5 to 7. Sorry, I take that back. It's Wednesday, right? Wednesday. Tuesday, tomorrow, there is a webinar on the Public Health Authority on drinking water, which I would commend that to you. It's at 1 o'clock Eastern Daylight Time. We will have 3 amazing speakers there, including Dr. Hannah Atisha, who is a pediatrician that found the elevated lead levels in the children in Flint, Michigan. Also on Tuesday, I'll be speaking in the Massachusetts Medical Society on firearm-related safety and violence. Wednesday, we're going to have a Public Health Week Twitter chat. I think it's from 2 to 3. I'm also speaking at the University of Pennsylvania for their Health Equity Week. On Thursday, I think, Dr. Jones, you're going to Puerto Rico to the Public Health Association annual meeting. I do not get a chance to carry her bags to that meeting, but I wish I could. I mentioned the happy hour on Wednesday. And then on Friday, from 2 to 3, we're having Student Day Town Hall, which is a Google Hangout, where we've are honored to have the United States Surgeon General, who will be hanging out with students on that particular day. So with that, I want to thank everyone for being involved in National Public Health Week. I want to thank Kim and her staff for all of their hard work in pulling this week off, which is just beginning. Yes.
Before you close, so it's not just what we're doing. There are many, many National Public Health Week observances happening across the country. How should people let us know about what they're doing?
Yep. So if you go to our website, at the National Public Health Week website, there is a partners box, and you can put in all of the events that you're doing this week on that website. It is, I think, an enormous opportunity for us to capture. We know that there are already many people that are involved in capturing activities around the nation on this week. And thank you very much for asking that very important question, because that's the way for people to get involved. And this is a week for us to educate, motivate, celebrate. And I think as I close, I want to just take another plug for those cities that are eligible to get involved and to consider strongly being part of the Healthy City County Challenge Prize. That is small to mid-sized cities and tribal communities are eligible to apply for that. And again, I just want to publicly thank the Aetna Foundation for their foresight and wisdom, and Garth for being a critical partner, the folks from NACO being critical partners on this, and of course our friends from CEO from Cities. Thank you very much, and everyone have a wonderful day.